Now we know that there are various causes for dark eye circles. Now one cause is that dark eye circle tend to be more common in people with darker skin tones. For example, in patients with Fitzpatrick, skin type 5 and 6. Now these might be true hyperpigmentation in the under eye area. Dark eye circles can also be hereditary. Research has found that if someone in the family has dark eye circles, these may also appear within the same family in other family members. Now, certain medical conditions, for example, in patients with atopic eczema, and these patients constantly rub their eyes, the excessive rubbing can also lead to increased swelling, inflammation, and broken blood vessels in the eye area, and this can give the skin a very dark appearance. In patients also with certain medical conditions, for example, allergic rhinitis or layman call it sensitive nose, the allergic reaction can trigger the release of a chemical known as histamines in the body, and this histamine will cause the blood vessels in the under eye area to dilate. Now we know that the skin in our eyelid and under eye area is some of the thinnest in the body, so these swollen blood vessels can appear darker than the rest of the face, also in the under eye area. Fifth cause of the eye circle is due to aging. Now, as we age, we lose fats and we lose volume in our cheeks and under eye area, and this together coupled with the thinning of the skin will cause the area in the under eye area to hollow out, and this can appear as the eye circle, and this can be worse as we become older. Now, tear troughs are the hollows that are found between the lower eyelid and the cheeks. Now, this sunken look is often a concern for many patients because it can make them look aged and tired. We know that tear trough is not exclusively the product of age. Tear trough is actually a very natural depression, and it becomes more visible as we become older. A mild trough can be seen in youth in many individuals. Now, depending on what's the cause of dark eye circle, the treatment then varies. If the cause of dark eye circle is due to hyperpigmentation in the under eye area, we can use a very effective laser known as the dual yellow laser to help to lighten it. Now, dual yellow laser is a US FDA approved multi-wavelength laser. It uses two different wavelengths, which is 511 and 578 nanometers. Dual yellow laser is not only effective in treating hyperpigmentation, it can also treat conditions such as acne and redness and melasma. Now, if the dark eye circle is due to loss of volume from the under eye area, we can use a hyaluronic acid filler to fill in the depressed and sunken area beneath the eye to give a very natural and very refreshed look. Now, when we fill up the tear trough, or the area below the eye fillers will flush out the appearance of the dark eye circles immediately, and the patient will look very bright and very rejuvenated. We know that tear trough injection with the filler is a very, very advanced technique, so it is very important for you to consult a trained and experienced doctor in order to achieve a very safe, effective, and natural-looking results. It is also important for you to ensure that the doctor use only either US FDA approved or HSA approved hyaluronic acid fillers. Now, the amount of filler that's required to treat tear troughs are different in different patients. It depends on how sunken your under eye area is. Generally speaking, for dark eye circles, it takes only one session for your doctor to treat the condition. Now, the results of the filler injection in the under eye area is immediate, and the results gets better as time passes by because the fillers get integrated with our soft tissue, and the results of the fillers can last 6 to 9 months, and it will last longer with repeated treatments.